There's lots of experiences that every dentist runs into that makes the day very hard. Some of the complications that we run into could be as something simple as just not getting the patient adequately numb. That certainly causes distress to the patient, but also to the dentist. And there's been many times where a patient comes in with such a big infection, or they're just a complicated patient, that it's very difficult to get them numb. That's certainly one problem we encounter from time to time. Certainly because we have to take a lot of impressions on teeth or molds. Some people have real problems with things in their mouth, so you can kind of stimulate this gag reflex. So that it can be difficult where you have a patient that has a really bad gag reflex that you can't get a very good impression on. That's another complication. Another one that we run into from time to time is, again, if someone presents for an extraction, they want to get a tooth taken out, and it's very badly broken. We know that it's going to be probably a little more uncomfortable for the patient, and certainly more difficult from our standpoint to get it out. So it's not as simple as just going in and basically removing the tooth, but sometimes it involves, a little more gory detail to basically do things to basically remove the tooth. Basically, it all goes back to being able to relate and being empathetic with the patient. Provided that you are listening to the patient and you're understanding their concerns and you're kind of talking them through this, it's more about kind of letting them know that you're on their side and you guys are a team and you're working together to kind of get to a common good. So most of the problems we encounter, are usually resolved with just talking with the patient, in a soft-spoken way and in an empathetic manner, that the patient knows that you can understand what they're going through and you're trying to help them get through it.